So another condition that might look similar to this is called granuloma annulare. I'm at Genesis Community Health in Garden City, Idaho, providing free dermatology care to uninsured patients today. This clinic is only for uninsured patients, and it's really hard for them to get specialty care. So we brought the motorhome in today, and we're doing full skin cancer screenings. We're addressing rashes or any other growths on the skin, and we're not really sure what we're gonna get. So come along with us for the journey, and let's see who shows up and what we find. This looks like something called an Acra Cordon or a skin tag, and they are pretty common on the eyes. So we can easily take care of that. So another condition that might look similar to this is called granuloma annulare. That's not necessarily related to diabetes, but it would have a very similar border, and it can grow and enlarge. Is this area itchy?
No.
Okay. So what I'm going to do is I'm going to prescribe some clobetasol for you. It's a strong topical steroid, so over time it can thin the skin. So what I'll have you do is use that clobetasol around the red border. You can use it twice a day for a week and then take a week off and just kind of alternate back and forth. This is a chronic condition. We won't cure it, but we want to stop it from spreading. So if she said it was related to diabetes, it's probably this condition called NLD, or Necrobiosis Lipoidica Diabeticorum. And we're going to treat it with that topical steroid 1 week on, 1 week off, and you're going to do that for a while. And if at any point that red border kind of dies down and is not active, you can take a break from that steroid for a while. And if you notice the redness coming back, you'll get back on treatment.
Okay.
So, and is your diabetes otherwise pretty well controlled now? Okay, very good. And there's a spot on the back, is the other one?
Yeah, well, I have...
Yeah, this is a benign mole. It's an intradermal mole. So they can itch, they can get irritated because they're raised, but this does not appear to be cancerous.
Right. Yeah.
They can be removed, you know, if they bleed or for cosmetic reasons. I don't think anything needs to be done with it, but if at some point it ever bleeds or changes, we could certainly take it off of you. And we're gonna go real cold, here we go. Okay, we're gonna let that thaw out, and then I'm gonna hit it one more time and close, real cold. So we didn't really know what we were going to get when we came here today because the patients were scheduled for us and they're all new to us, but we saw an interesting diagnosis today on something called Necrobiosis Lipoidica Diabeticorum. It's a mouthful, so we just call it NLD, but this is a rash that occurs on the shins, and it's much more common in people who are diabetic, but it can occur in individuals without diabetes. The challenge is that this is a condition that is progressive, and it actually scars the deeper layer of the skin, the dermis. So once it's there, we can't take it away. Sometimes some improvement can be made with lasers, but it'll always look atypical. But what we're focusing on with her is treating that active border so that it doesn't expand, because this can be itchy, it can be painful, and if it goes on for a long time, it can actually ulcerate and start to bleed. And in that kind of skin, it's hard to get it to heal. So it was important that we're here today providing this kind of care, and hopefully if you have a condition that looks like this, you know what it is and can go get it treated appropriately. Thank you so much for watching the video, and we'll see you guys next on the Mobile Clinic.